Thank you. I'm very honored to get to talk with you today, and I think this will rank in one of the moments when I get ready to defend my dissertation, hopefully sometime this year. I'll think, well, you know what, if I could follow Dr. Corby Smith and Salvador Balcorta at a seminar series as a speaker, I can do anything. So, this will be one of those moments that I remember as getting up in front of a crowd and sharing information about which, you know, you're just never quite sure, and especially when you haven't, when you didn't know you were going to talk. I'm very fortunate that today was a topic that is one that I'm very passionate about, and is also one of my, I don't know, I guess you would say what I spend my life doing is thinking about how educational disparities and health disparities are related. So I'm going to, please excuse the slideshow if it doesn't seem like it's quite cohesive from beginning to end, but it was one that I was able to pull from my email with some things that I had been working on, and I'm very happy that it kind of dovetails really nicely with some of the issues we've already talked about this morning. The first slide I have up is what Salvador Balcorta mentioned. You know, we all know about educational disparities. We all know about, you know, high school dropout rates and how Latinos have much higher rates than other ethnic groups. Well, this slide, I think, really brings that home. On the left, the graph you see there is a graph of high school dropouts in the United States. High school dropouts in this graph is measured by if you are between the ages of 16 to 24, you do not have a high school diploma, and you are not in any kind of an educational program. So for that, on the left, that's a definition of high school dropout. As you can see, Hispanics have a rate nationwide of about 23%, compared to just over 10% for blacks and just over 5% for Anglos. Now, if you look at the high school attrition rate in Texas, which is the graph on the right, the high school attrition rate is the number of students that start school in the 9th grade and do not finish within a 4-year period. Percent, and this is in Texas, 45% for Hispanics compared with.
No, we stay here.
Oh, okay, we get to stay. And you thought you were going to be saved by the bell. 20% for Anglo. So again, quite a difference. Here in Texas, if you look at the slide on the graph on the left, this looks at adults. It's okay?
No, it's okay.
Okay. Adults age 25 and older who do not have a high school diploma. So 25 and older without a high school diploma on the border, and that's all of the border in Texas. The rates for being 25 years of age or older and not having a high school diploma is just over 40% on the border, compared with 24% for the rest of Texas. And on the right-hand side, this is the one that's really scary. The graduation rates for Texas public schools, and again, as a licensed school counselor, I have not worked in Texas as a school counselor, but I have in New Mexico. And like Mr. Balcorta touched on, there are so many issues and factors that contribute to these really sorry statistics, which are that the graduation rate for Hispanic men in Texas is hovering just over 50%, compared with a little over 70% for Anglo men. The discrepancy is not quite as great for Hispanic females, and I bring this up not because today's topic is focused on education, but because what I'm going to talk about at greater length is the connection between educational disparities and health disparities. So this is one of my all-time favorite slides that I think really illustrates how much educational and health disparities are just inextricably intertwined. You can't pull them apart. You can't. Who's seen the Unnatural Causes DVD? Has anybody seen that? It's called Unnatural Causes, Our Neighborhood's Making us Sick, many of you. And that's, I think it was Leonard Syme, there's a fellow in that movie, and he uses those words, inextricably intertwined, to talk about how all sorts of social and cultural factors, you know, you can't separate not having insurance from not having enough education, from having, you know, living in a certain neighborhood. There's all those things come together and impact your stress levels and influence your ability to be healthy, to stay healthy, to get care. And what this graph shows is smoking rates by level of education. So the first question sometimes people ask is, well, does that mean that the more education you have, you know more about how smoking is bad for you? And that is expressly not what I think this graph shows. What this shows is that down there on the left, the yellow bar, if you have a graduate degree in the United States, smoking rates among people with a graduate degree are about 5%. Okay, smoking rates for those with a 4-year degree are about 10%. With a high school diploma, about 22%. People with 9 to 11 years of school, smoking rates nationwide are a little over 30%. And for those with a GED, smoking rates are over 40%. In the military right now, this is not on the graph, but 30% of active duty military people smoke. 50% of deployed military personnel smoking rates. So what that says to me is not that people with graduate degrees know more about the perils of smoking. What it says is the levels of stress, the levels of advertising targeted to people with, just like Mr. Valcorta was talking about advertising, and we know that in this area people target young people and Spanish-speaking people to use alcohol and tobacco. So just like in that DVD, Unnatural Causes, talking about how our neighborhoods impact our health, how stresses impact our health, what this graph says to me is that the more stress you have in your life, which generally accompanies a low education level and the lower income levels that go along with that, the lack of control and jobs that go along with that, there's a lot of research on how high demand, low control jobs impact stress levels. And study after study after study has shown that when you ask people why they smoke, everybody, I mean to the 99-point-something% of people that smoke, regardless of their education level, they know that smoking is bad for their health. It has nothing to do with not knowing about the perils of smoking. What it has to do with is it's the only thing in my life that I can control. I walk out of my minimum wage job, or I walk off the, whenever I see in movies, they usually use the assembly line workers as examples of what we call high demand, low control jobs, because you're just standing there and that thing's moving and you're keeping up with it, and and you can just see the look on their face. And my stress level rises just watching that happen, just watching people have to work in that environment where, and you carry that a bit further, and it's not just you can't walk away from that line for 30 seconds, it's that you can't walk away from that job for a half hour longer during your lunch break to go run an errand, or to go cash a check, or to, I felt just like standing up and applauding when I heard about Mr. Valcorta's plan to put the payday loan places out of business, because it just, we prey on the people who have the fewest options, and it's usually the people with the least educational levels that have the fewest options, which in turn leads to having fewer and fewer options when it comes to not just health insurance and not just access to care, but even being able to take the time off to go get it if you had it. So, so enough on my smoking rampage, but I'm going to move on now to talking some more about education at, again, piggybacking on what Mr. Valcorta was talking about with La Fe Preparatory School. I had just had the good fortune a few weeks ago to meet one of the, didn't know much about the school, met with one of the third grade teachers just in a social situation. She was actually dating one of my friends' sons, and we met. Oh, what do you do? We're talking and talking, and she said, well, I'm a school teacher at a dual language school. And I said, oh, where's that? She said, La Fe. And for those of you that don't know, their dual language program, the kids actually, on one day, they have all their classes in English, and the next day, all their classes in Spanish, and it alternates from day to day. And so teachers work in pairs. The math teacher, the two math teachers are a team, and the kids have, they're following the exact same curriculum. It's just that one day they're doing it in an English classroom, and the next day they're doing it in a Spanish classroom with the other part of the team who speaks Spanish or who instructs in Spanish. So she was going on and on about the school, and she was saying that one of the really neat things was she said, these kids in third grade, they all know they're going to college. And I thought, and it just kind of made me, how often do we hear from kids in 9th grade, 10th grade, 11th grade, 12th grade that I can't go to college, or I'm not going to college, or I haven't thought about going to college. And so that was kind of brought up another one of the things that that just to me are one of the most important things in my life, and one of the reasons that I started a PhD program 2 years ago was that I came very late in life to academia. I was 40 before I ever started a master's degree, and so was quite, what everybody would call middle-aged when I started a doctoral program. And as soon as I got my master's degree, I had the good fortune to be able to start teaching undergraduates up at Holloman Air Force Base, and I still do that. And my favorite class to teach is an introductory psychology class. I think I've taught it like 23 times now. And I love it because for most of my students, it's their first college class. They're all active duty military. And many of them, some of them have been to college and dropped out and are just coming back. Some of them never thought they would go to college, and now they have the opportunity in the military. And I just remember, being absolutely I didn't have words to describe when I had sitting in front of me in my class somebody who had been in the Air Force, and this is not just one person, this is student after student after student, people who'd been in the Air Force for years and years, who were highly successful in their careers, who were 1 or 2 ranks away from the top enlisted rank, so had 10, 15, 20 years of supervisory and leadership experience and all kinds of technical schools, and they're sitting in front of me, and I think, wow, I have some really talented and talented, smart people in my class with all kinds of experience, and their response is, I didn't think I could do college. I've waited 20 years because I didn't think I could do college. And I just remember thinking, but you're an E8 in the Air Force, and you've been, you teach avionics, and you manage 100 troops, and you deploy, you do all these things. And there is a culture that, and I'm getting to the slide, but there is a culture out there in academia that says if you don't understand it and you're not a part of it and you haven't been raised to be a part of it and you don't get it, you might as well not even think about it. And it's not that anybody tries to give that message on purpose. Maybe there are some really icky people out there that do. But I think for the most part, it's just that if you haven't been sort of acculturated into it, you don't think, well, yeah, I'm going to go to college, and yeah, I'm going to do this, and yes, I can get a graduate degree if I want to. And that brings me to the point of this slide, which is that American Journal of Public Health recently had an issue, and what it was devoted to was diversity in research on mental health and HIV/AIDS. And they were talking about, if we really want to address health disparities, it's not just enough to go out there and provide better health options. We need to be turning people in the underserved communities, turning them into part of the group that's doing the research and that's teaching at universities and that's getting the grants. And what they said was that we need to have intentional and intensive mentoring to attract, retain, and promote researchers who will diversify the scientific community. And then if we ever want to really address health disparities in a holistic way, that we need to start by making an effort to ensure that we're not just advertising nationwide to bring people to whichever underserved community you're a part of, but that we're making people in those communities say, wow, I'm going to get my degree, and I'm going to become a researcher, and I'm going to do my own research. Despite increasing focus on community-based research, why isn't the community more broadly represented among those who study the very problems that affect them? And I'm going to skip a few here and get to, oops, okay. I guess I'm going to talk without a slide. So the slideshow I pulled up doesn't have the ones that, can you close this for me, Chris? Because I'm about done with slides. What this issue pointed out in Journal of Public Health was that among, we've all seen the statistics, right, that by 2050, about half of our nation's population is going to be Hispanic or Latino, and that right now that number is growing. Well, and those of you who are students in a Master of Public Health class that know the answer to this, be quiet for a minute. But for the rest of you, anybody want to give a guess on, okay, knowing that the percentage of Hispanics in this country is rapidly increasing and is probably now at about somewhere between 25 and 30% nationwide and much higher in other communities like our own. Anybody want to take a guess at the percentage of, at what percentage of PhDs awarded, and the year the statistic was from was 2005, what percentage of the PhDs awarded in this country that year went to Latinos? Anybody want to take a guess? less than 5%. Absolutely right. 3%. Okay, 3% of the PhDs awarded in 2005 in our country were attained by Hispanics. Anybody want to take a guess? The percentage of, at what percentage Hispanics account for NIH funding in terms of a percentage of NIH lead researchers on NIH funding projects in the same year? How about 3% again? It's like the rule of threes. And that, I think we tend to think a little bit less of it in a community like El Paso because we get recognized all the time at UTEP for being, top 10. Lately we're in the top 10 for MBA programs for Hispanics and engineering programs, and we get a lot of accolades. And if you walk around campus, you don't notice a disparity. You don't think, gosh, there's only 3% of the students are Latino. That's not. We don't have that in our community. So I think sometimes we tend to forget that looking beyond us, we need to be thinking about whether it's at 3rd grade, whether it's at La Fe, at the preparatory school, and getting kids to think, how am I going to go to college? And getting communities to think, how am I going to make sure those kids get to college and don't end up, those cute little boys in the picture. And I think all the classroom, all I could see was the girls in their cute little skirts, but I understand the boys wear like little khakis and they have a tie. And so similar, how do we get those cute little kids thinking in the 3rd grade that, well, duh, yeah, I'm going to college, and there's so many options for going to college today, whether it's, starting out, staying locally, going other places, but just anybody that's ever applied for financial aid knows what I'm talking about. If somebody doesn't sit you down and say, guess what, you have these options, here's how to do it, I'm going to help you do it, I think you should do it, even for people who have the access, if you don't grow up thinking that's what I'm going to do, and I can be part of that research team too, and I can make a difference, and I'm not going to work 3 jobs like my dad does. We see that guaranteed. If I asked for a raise of hands, everybody would be able to name somebody where both parents are working 2 jobs, and they're working 67. I had my niece said to me the other day. Her mom just went back to school, so she's working full time and going to school, and we went to White Sands a couple of weeks ago, and I said, oh, how's your mom? And my niece said, and she's in high school, she said, well, I haven't seen her since last week, and they live together. But it was just, school, working. So, on the one hand, she's out there going back to school, but the flip side of that is too many families don't see going back to school as an option, and and they wait until someday, and then it doesn't happen. And so when we look at, back to that smoking graph, when we look at that smoking graph, the other side we don't mention is the healthcare cost associated with smoking, right? So if you pile onto that, not just people with the educational disparities and health disparities go hand in hand, but when you look at the big picture and how it impacts not only getting preventive care, access to care, but the issues that people are going to face on down the road, it's all related. And when people are able to have access to smoking cessation clinics, and that's one thing here in El Paso, we're sort of like the front runners in some things to do with smoking cessation. And the reason it's working is, number one, we have the community control policies in effect, but we also have comprehensive access programs so that it's not just people with private physicians who are getting medication help they need, or access to patches, or access to counseling, or quit lines, and and those kinds of programs that reach across, that don't just rely on private health insurance to reach people, can really have an impact. But I would say, kind of the takeaway message from my talk, I guess, is that whenever we talk about health disparities, we always need to be thinking about educational disparities, because by building that educational foundation, automatically we increase people's awareness of options about healthcare. We increase their ability to make job choices, and I doubt there are very many people without a high school diploma in this room today. And there are people with many advanced degrees in this room. And I guarantee you, everybody who has at least a high school diploma, and then however many more degrees you have, every single one of us can think, wow, did I ever get a whole bunch more opportunities when I got that degree, and that degree, and that degree. And along with those degrees comes options and choices. And along with those options and choices comes better access to health care, better ability to make choices about which jobs we take and which health plans we choose, you know, let alone, and I'm not going to get into the politics of healthcare reform, but I will say that as educational opportunities and access increases, some of the health issues are going to, you know, we're going to find that we're addressing those at the same time. So I would just ask each of you in the work that you do, and many of you I know, and I know about the work that you do, and so many of you already are doing work where you're doing that intensive mentoring and working with people and getting them in school and keeping them in school, whether it's yourself or your peers or your kids, or but that's you know, the more we can get in school and keep in school and get out of school on the other end with a degree, the healthier communities we'll have. So that's my message today, and thank you all for your patience and for being here today, and for the work you do. We're very, very grateful. Thank you.